BioBalance Healthcast, Episode 154, Side Effects of Testosterone Replacement, Part 1.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Today we want to continue our conversation about side effects of hormone replacement therapies. And today we want to talk about testosterone. People always have concerns when the conversation turns to, should you replace the hormones that have become deficient through the natural aging process? As you get older, your body begins to make fewer and fewer of those hormones, and they're critical hormones. And so medical science can now replace them, but then the question comes up, what's the cost-benefit ratio? Cost-benefit in terms of dollars, what does it cost? And do I think it's worth it in my quality of life? And cost-benefit in terms of side effects. So today we're going to talk about testosterone and the side effects that do exist if you replace testosterone for some people. What Kathy will tell us is that almost no one gets all of the side effects. There typically are one or two side effects. We'll talk about what those are, we'll talk about how they're managed, and then that can give you some information for making better decisions. If you happen to be that one random number that is subject to multiple side effects, then it's a more serious conversation for you, but it's still a serious conversation to have. It's still something to consider in terms of your quality of life. So we're always in these podcasts affirming the importance of good decision making and how our decisions made in the medical field and personally how our decisions made. So we want to give you good quality information. So we'll talk about risks and side effects of taking testosterone for this podcast. And the first one that comes up for a lot of women is the question of hair. Facial hair growth and hair loss on the top of the head. So talk to me about hair loss.
Well, hair loss is huge for women. Men consider it kind of, oh, I'm aging, I'm losing hair.
Well,
But for women, we don't ever expect to lose our hair unless we have chemotherapy.
Yeah.
I mean, in general. But
right.
All of us have seen little old ladies.
Well, you look in the shower when you get out. It's
hair
like,
on top.
Oh my God, who's been in my shower? That can't come from me.
Is that your hair you're talking about?
Yeah, exactly.
Okay, well.
Yeah, it all went down the drain.
In any case, women don't think we're going to lose our hair. And when we don't think that we should have to have facial hair, and we shouldn't.
Right.
But,
well, you get all those jokes about the bearded lady.
Right. And when people come to me, that's their biggest fear is my hair on my head going to fall out? And am I going to have facial hair like it is a deathly illness? Okay. Yeah. So this is not something that is harmful to your life
health.
Or your health. This is something that is aesthetically not pleasant. Now, we have lots of ways to get rid of hair, lasers and waxes. We can use an epilator, which is one of those things that is like a tweezer, only it has lots of little fingers that tweeze hair. But I prefer to say, this doesn't have to be you. This is going to be something if you had hair on your face, which I did when I was young, and I have much less now, even though I'm on testosterone. But if you had hair on your face when you were young, as a female, you'll have it again if you get testosterone back. So I asked that question.
Can I
Yes?
When you talk about hair on the face, I mean,
we're talking about a little mustache. We're talking about like the shadow of a mustache.
You can get that. What's it called? Lugo.
Lanugo is white or baby hair.
Yeah.
And that's not usually not something somebody sees or feels.
Right. I mean, in certain lighting, you can get like a blush of hair.
Yeah.
You can see and again, most women have some of that.
Most women should have some of that. It protects your skin from the cold.
Well, exactly.
So it's not a bad thing to have.
But what you're talking about is darker hair,
firmer,
more bristly hair,
right.
like
or just
beard hair.
Darker hair. I mean,
just
when I was younger, I had very, very soft, but very, it was dark. So I bleached it. You could bleach it, and then no one saw it. But it wasn't coarse, and I still don't have coarse hair on my face. But I take all of the tricks that we've learned to prevent facial hair, just like I give to my patients.
Right.
I take spironolactone, which is meant to be a diuretic, but it's not very good at that. But it's great at preventing facial hair on women, and it's great at making our hair grow on our head. Yeah. So basically, that is one of the ways I prevent it. And so I actually have less facial hair than I used to
Okay.
when I was young. But most people are so worried about that, and all I can say is don't shave it, because then it's going to be like a man's beard. It's going to be generally, most people don't get away with that, but a few do. But it's going to feel like a beard when you're kissing your husband, or it's going to feel like a beard, or your grandchild, or
You're nuzzling a baby's butt.
Yeah,
you'll say, wait, that hurts.
Nuzzling their face, and then they freak out. But basically, that's not something we want to have. So razors are out, but plucking, pulling, lasering are all fine. But I prefer to prevent it, and spironolactone is the prevention. And then if somebody's really hairy, because body hair also comes with this. Some women lose all their body hair when their testosterone goes, and then they gain it back. It starts growing back when they get their testosterone back.
So they're not as disturbed typically about that as they are facial hair, because the face is always visible. And
that's right.
Every culture has, and we've talked about this in some previous podcasts, about the definition of beauty. Every culture anthropologically experiences or markets their concept of an attractive person, whether you're using tattoos or jewelry or makeup or whatever it may be. And in our culture, facial hair on women is not considered to be attractive.
That's true. And in Italy, it's kind of normal. And I'm half Italian, but we are the product of our genetics. The other thing that I suggest to people, to my patients, is to take Finasteride, which is a medication that was meant to prevent hair loss in women from aging when we have a lot of androgens from our adrenal gland. It's to prevent that at the hair follicle level. And so Finasteride in women is very good at preventing facial hair, preventing body hair, preventing hair loss on our heads. So in that way, that's one of the things that we use to prevent it. If somebody says, oh my gosh, I've had tons of hair, I used to have tons of hair and I tried lasering, it didn't come back. Sometimes I'll start them on both. But I use a very small dose every second or third day of the week. It's not an everyday thing.
Now, for those of our viewers who are information junkies, what causes the hair growth has to do with the DHT.
Right.
And the DHT is the testosterone, dihydrotestosterone, that is the free testosterone that you need to increase.
Nope.
No?
Nope.
Then help me understand.
Okay.
I'm saying it wrong.
Testosterone is metabolized in the liver into two things. One is an estrogen, and we'll talk about that at another time. The other is DHT, dihydrotestosterone.
Okay.
So testosterone is metabolized into this DHT. DHT then circulates, and when the DHT is high, especially when the DHT is high and the free testosterone's low,
okay, that's when
we lose hair. So the goal is decrease the DHT and increase free testosterone. And so that's one of the ways we do this, is by dosage and by shutting down DHT. So it's not just the testosterone. It's not really the testosterone at all that causes the hair loss or facial hair. It's one of its metabolites, which we then control. So we don't have to shut down all of the testosterone just to make you aesthetically beautiful. We have to shut down just the metabolite.
Okay, so you get your chemistry set out, and you got spironolactone, finasteride, and testosterone, and you just balance the dosage for the best effect to get the blend of results that you want.
Right, you want that DHT to be low, the testosterone's okay to be high, but those two medications work in a little different way from each other, but they both block hair growth on the face, at the skin level, hair follicle level, and they both stimulate head hair. So
even if you're losing some hair on top of your head, those medicines will help stimulate the growth of it.
Right.
Okay. So anything else about hair that we need?
Well, hair's also affected by thyroid, so we're not talking about that today, but you can have hair loss from other things. You can have just to make this complete. We have people who come in with hair loss, and they don't have any testosterone at all, but they're making a lot of DHT from their adrenal gland. And they're using up all their good testosterone and making DHT out of it, or their thyroid's low, or their estrogen's low. Because women who have just hair loss right up here, that's a loss of estrogen. Testosterone loss is right here and on the crown of your head. So it's when your temples start moving backwards and hair loss here. But thyroid's all over your head, estrogen's in the front.
And again, we're talking
I can look
about
at somebody and this is women.
Yeah.
And I can look at somebody and tell which hormone it is, usually, unless it's all over their head and I don't know.
Because for men,
it could be several things.
Hair loss and receding hairlines has to do with intelligence and virility, right?
Yeah, that's it.
Oh, okay.
As long as you want to believe that. No, in men it
Well,
is
I try to
also.
tell my wife anyway.
It's also as
Yeah.
you don't see young men with the testosterone that's off the charts with hair loss.
Yeah.
It's in men. It's still the DHT is too high and the testosterone's too low. That's hair loss.
Yeah.
So my goal is to bring testosterone up while keeping the DHT low. And then we can keep your hair. And yours has been getting darker, by the way.
Has it?
What is that?
I don't know. It's not Grecian formula, I
It's
can
not?
tell you that. So another side effect that some women express a concern about is if they take testosterone, will their voice drop? Will they sound like their teenage son after he goes through puberty?
That was good.
Yeah.
I
I've worked with a lot of teenage boys.
Yeah. Okay, so when you go through testosterone deficiency, women's voices usually go up a little bit. As our testosterone
Which is not
drops,
to say they become more strident. The
no,
pitch
no, no, no.
just changes.
The pitch increases, like alto goes closer to soprano. But when we replace testosterone, the pitch does usually go back to normal, whatever their normal was. But dose dependently, meaning the higher the testosterone, the lower the voice. Okay, in some people. You have to have the genetics for it. You have to have the receptor sites
So
there.
like a tuning
it's
fork.
not everybody.
Oh,
Well, I have as high a testosterone as anyone in my practice, and my voice is not low.
yeah.
And so I don't have the genetics for a low voice.
Right.
I don't have that, and my voice doesn't crack, and and that's just an example of low risk for voice changes and high risk.
But it never leads to, I mean, the testosterone replacement doesn't lead to like the development of nodules on the vocal cords or things like that.
That's not what testosterone causes. It just changes the tension of the vocal cords, which changes pitch in some people.
Right.
However, you can genetically have a risk for that, or you can have past medical history. And I just found this in a patient that thought her testosterone was causing this, but she had the problem to begin with because she had, checked it on her intake sheet. But she had reflux, where she had so much acid in her stomach that it had caused trouble with her vocal cords in the past and lowered her voice.
Acid reflux.
Acid reflux, and she had a burn, and I didn't get the details of the burn, a burn of her vocal cords in the past. So
A burn from the acid
no,
reflux
a different
or from
burn,
something else?
A different burn, a second type of problem,
Yeah.
which I don't get. So, but that put her at risk for voice changes anyway.
Sure.
So usually when we have a voice change, we drop dosage on our testosterone, and then the dosage is the key. If we drop it in people that have this as an issue, their voices come back up. It rebounds. So we don't see a problem with that. But when we have somebody who's at risk, they've had nodules in the past, they've had damage or irritation or reflux, like the acid goes all the way up to their vocal cords.
But it's also pretty much a subjective issue in terms of hearing, listening. And for people on
Yes
the
and
extreme
no.
ranges, it's pretty noticeable. I mean, if your voice
Yeah.
changes dramatically.
If you're a singer, this is huge, and
Right.
that's why I asked occupation and that kind of thing in the beginning, because if you are in the opera, I may just give you estrogen, even if it depends on what you choose, or I just give you a tiny bit of testosterone, which is probably not going to take away all of your symptoms, but your voice will remain the same. I just don't want to take the chance. It could not do a thing.
Right.
Some people say, well, let me try it.
Yeah.
Let me see if it does anything.
Well, and again,
and many times it doesn't.
If it's a mellowing change or a moderate change, it might be aesthetically pleasing. We're talking about radical change where you call somebody on the phone and they say yes sir, and you say, but I'm a woman.
In fact, I don't really think we haven't really had that
kind of change.
Right.
Yeah.
So that hasn't happened with us, and with the way we give testosterone, it doesn't tend to do that.
When we were prepping for this, you mentioned in passing about the sort of generative cause of acid reflux in women. You were saying that one of the pre-existing conditions that may
pregnancy.
be impacted by this
Well, your diaphragm is a muscle that runs right under your ribs, and it runs. Most of our muscles run up and down, or diagonally up and down. This runs this way, separating your chest cavity from your abdominal cavity, where all your intestines are. But your stomach's in the abdominal cavity. When we get pregnant, the muscles where the muscle runs this way, but if I do it this way, there's an opening in the muscle that's little. So your esophagus, where your food can go down, can go through that big muscle that runs all the way back to your backbone. So when we are pregnant, everything stretches, everything loosens up, and that opening gets really big. And then when we're done being pregnant, it doesn't always go all the way back. So there's this opening where the stomach can push through into your chest cavity, and it's making acid in the stomach, and it's pushing it all the way up to I mean, that's not necessarily what causes reflux all the time, but it can slide up and down, but it can cause acid to go all the way to your vocal cords.
Yeah.
And you can actually damage your vocal cords that way. But women have that much more than men, unless men gain a lot of belly fat, and they get the same thing. It's a hernia, basically.
It's a hernia.
It's an opening of the muscles. It's like you could have a hernia here in your intestinal wall, all your intestines, and the peritoneum over them would all just kind of bulge out through the opening in your muscles.
So what they call a hiatal hernia?
No, this is abdominal hernia, where these two muscles, instead of being together, go like that, and then you have a big bulge, and that has intestines in it. So this is a different idea. Your stomach's bulging up into your chest where it shouldn't be.
Yeah.
And that causes a hiatal hernia.
What happens when your chest falls down into your stomach?
You mean breasts or your
No,
chest?
when you get old, like men, you know. And mine used to have like pecs and stuff, and now I have.
That's not enough testosterone, too much estrogen, and
not enough exercise. 8-ounce curls. Yeah.
Okay, so that's basically our.
So we're talking about muscles.
We can treat the voice.
Yeah.
And it's a transient thing. It's dose dependent. It'll go back.
Well, and when you're talking about previous history and pre-existing conditions too, women who have professions that require them to do speaking, like teachers, who try to get volume by forcing air through their larynx, they almost always blow their voices out.
Do they?
And yeah, because you need to project. Richard Burton had one of the best voices in the entertainment industry. And when Richard Burton was a young man, his father took him out to the cliffs of Dover and put marbles in his mouth and had him whisper to be articulate and be hearable above the cliffs of Dover, the sound, so that Burton didn't need a microphone system when he was in the theater. He had this ability to project, but he learned how to project from his diaphragm. When you learn to be a speaker, you have to learn, or singer, you have to learn to breathe and project.
Yes.
And people that don't learn those things try to get volume by screaming, and I've known a lot of teachers who have voice nodules and voice problems because they never learned how to talk.
And we usually send people to the ENT, but the path of least resistance is for the ENT to go, it's your testosterone. I mean, you need to have an exam. You need to have it looked at. You need to have other things ruled out. It shouldn't just be
we're back to the doctor-patient relationship again.
Right.
Somebody's got to spend the time to look at you and talk to you and say, what are you looking for? What are your concerns? What are you afraid of? What's a risk factor?
But honestly, every time this has come up, we've found other things going on before they ever started hormones that put them at risk. So that's something that always has to be considered if you have those things before you start taking testosterone.
So we are talking about the side effects that occur when you take testosterone as a replacement,
or that could occur.
Or that could occur in some people, but they're concerns that get raised, that they occur often enough that people say, well, I've heard this could happen. What if it happens to me? How would I know?
Testosterone doesn't cause cancer. So these are all the things they ask me in the very beginning. Does it cause cancer? No, testosterone does not cause cancer, especially, there's not even a question about it in women. You know, there's still a question. It doesn't cause prostate cancer from Dr. Morgenthaler's book and a lot of other research, but basically it does not cause cancer in women. So it's not a risk for that. It doesn't have anything to do with breast cancer except to maybe prevent it, but it is a good hormone for that. And no, it's not going to cause a heart attack, because the way we give it, it actually improves your cholesterol, improves your triglycerides. It actually decreases inflammation. So the way we if it's not oral, it will not cause that.
It's not going to cause road rage either.
No, and it doesn't cause you to be angry. It may cause you to be your old assertive self, which it did for me. Yeah, I mean, when I didn't feel well and I had no testosterone,
I ever knew you when you weren't assertive.
You didn't know me then.
I didn't know you back then. All right.
Yeah.
So there are a lot of these questions that people have that need to be answered. And we've talked about a few of them today. And in our next podcast, we're going to talk about some others. We're going to talk about oiliness of the skin, and particularly on the face. We're going to talk about bulking up with muscle mass if you take testosterone. We're going to talk about some sexual things, clitoral enlargement, itching and swelling of the vulva. So come back next time to hear some of the other concerns about hormone replacement therapy.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Find Brett Newcomb at brettnewcomb.com.